Hello, everyone. My name is Tatiana Lishmanova, and it's my honor today to participate in this conference. The topic of my speech is innovation in medical education for a better tomorrow. And let me to start with my background. Why did I decide to speak about this topic today? So my journey in medical career starts from MBBS in Pacific State Medical University. It's in Vladivostok City, Russia. And then I was so excited about medical education because I had the opportunity to have internship in Japan and China. Also, we had international department back to that time. And I was like searching for different attitude in medical education for different approaches. And then I also had a chance to go to Dominica to be a faculty member in American Canadian School of Medicine. So today I want to share with you this journey. Let's start. Let's firstly speak about the practice. You know that for medical specialists, practice is a key to success, and knowledge is of no value unless you put it into practice. I'm truly believe in this, and this is a quote from Russian author Anton Chekhov, and to my mind, it's really crucially important to be more practical because theoretical knowledge is basic, it's your fundament. However, if you don't put it into practice, it's really nothing. So let's speak about my own journey. And this journey, I think it also will lead you to the real one understanding. What does it mean to be a student in the medical field? What does it mean to give your time and give your priority to understand this deep one field as medicine? So I started my journey as a medical student, and it was all about a real practice. It's about touching patients, palpation, auscultation, percussion. So that time we didn't had so many equipment to do it by digital. We were forced by teachers to do it by ourselves, and it made us to be more adapted to real one practice, and I really admire this. And you can see on this picture on the first one, it's my colleague. So she led me to hear your tones of your heart. And the second one, it's our anatomy classes, where we had chance really to see organs and imagine like when you have just started this path, you're like, what? This is brain? What? I can touch lungs? So for sure, for us in the first one stage, it was like more about this funny experience, and we could not imagine that it will influence so much on our careers that we will be really prepared for practice. And I'm really grateful for this for our teachers. And now to simulation technologies that you can see on these slides that when I went to American Canadian School of Medicine to be a faculty member, I realized that I also have to study now all that related to digital. The program on Caribbean island, maybe you've heard about this. It's 2-year studying program. You are preparing directly to special one examination, UCMLE, for step 1. And definitely for doctors, we also prepared the simulation 1 classes. On the first one picture, you can see this TB patient. by the stimulation, you can palpate, to do percussion, to auscultate. So everything is the same, and it's implementing in this all the normal and pathological one issues. To my mind, it's a really incredible one, this device. However, I told you that for us, it's also important one to see real one cases, um, to see people, to see patients whom we will treat in the future. So I think that it's better to combine two approaches. And you can see on the second one picture that we also had this like role gaming. We were trained our future doctors to how to act in several one cases. So they had a scenario with the all this reasoning, what happened to patients, about also laboratory and instrumental one results, and then future doctor student should recognize what's the main reason of these symptoms. And we were monitoring this job by sitting in another room and looking to the screens. We also had the evaluation one list, and after this session, we also had evaluation session to watch this video together and to analyze what did happen and what mistakes did the student make. Honestly, I think that it is a really effective one way for them. They knew that this one it's not real, but they were so excited and also scared. So this one is real. It's not only preparation by books to studying hard for all these tests. It's some some actions that can really give you knowledge and that can really also give you a chance to listen to the doctor who already experienced this. And we really tried our best to show this one for our students. And now also this slide represents for you that in Russia, this system was also changed rapidly. And in our medical university, we have simulation one center. And this center, it's not only about like first aid, because maybe you've heard that we study in Russia 6 years, and last year we have accreditation examination. It includes tests, it's 60 questions, and then we also have special one, situational one task. And the third one, it's this simulation one center where we have different one stations. And in each stations, we should do some actions. And all this time, we also monitored by teachers. And only if we made everything successfully and we didn't do any mistakes. So after this, we're going to get this accreditation and to work in healthcare system in Russia. So now students who are studying during 6 years, they also have a chance to come to these classes and to get experience before this accreditation. That's also really beneficial for them, because we had just like few times classes, and then we had this exam, and it was really stressful for us because we used to work on real one patient, and then this happened. So we were not ready. And I told you that it's still different. Even nowadays, digital devices are on the top, and it's made really so close to a real model of the human. But to my understanding and to my real experience, no, nothing can replace real practice. So overall, I think that yeah, digital equipment made us to really improve medical education, and it's better to do it in combination. And the last one thing that I want to tell you today during this presentation is that all that we are having now, all this experience, it's also have a purpose, because the future of medicine, it's also related to telemedicine. And telemedicine, it's really also the grade one tool to monitor patients from every single part of the world. And when you live in a big country, you know that some places, rural places, they don't have so much access to healthcare system. And in this way, telemedicine is really the best one tool. So doctors nowadays are trained also to this future, and that's a really incredible one. Thank you so much for your attention. I also wish you great one success in your medical journey. Keep going and you really can make it.